So hello, everyone, and welcome to Physician Spotlight. I'm your host, Dr. Lindsay Russell. Physician Spotlight is a forum to learn more about the outstanding senior leaders, young rising stars, and international colleagues in the field of nutrition, and to discuss important topics and ideas with the help of ASPEN. We are bringing these videos to you. So it's my pleasure to introduce our guest today, Dr. Simone Silvestre. Dr. Silvestre is the lead coordinator of the Multidisciplinary Nutrition Therapy team, the Hospital Felício Rocho in Belo Horizonte, Brazil. She's also an avid senior member of the Brazilian Association of Nutrology, where she's a professor that leads the advancement clinical nutrition courses. In addition, she's also a member of the Physician Engagement Committee at ASPEN. She's truly a gifted clinician with an interest in a variety of topics, including healthcare advancement through data management and quality improvement within nutrition. I'm so excited to have you here, Dr. Silvestre, and thank you for joining us.
It's a pleasure to be here. Thank you for having me.
Of course. So I want to begin with the first question that we generally ask everyone. And really what we want to know is, how was your journey into a career focused on nutrition? How was that journey for you?
Well, it started in 1995 when during my internal medicine fellowship here in Brazil. It was in a hospital that we had a team of enteral and parenteral nutrition. So there it was when I get passionate about clinical nutrition. I just saw the importance, the significance of nourishing the patient and how fast they get better. So since then, it is almost 30 years now. I always work with clinical nutrition, with nutrology. That's our specialty here in Brazil. So after that, I did a fellowship specifically in nutrology during 2 years. And then from now on, I was in Felício Rocho working there.
Oh, that's so wonderful. And it certainly, I can feel your passion through this interview and getting to know you through the Physician Engagement Committee. And through your involvement in these committees or ASPEN or the Brazilian Association of Nutrology, how has that helped foster your passion for nutrition or helped advance your career or even develop mentorship? How have those associations helped?
Well, the first thing that I think is important when we are doing all these groups, ASPEN and Brazilian Association of Nutrology, is that we are with each other, so we can learn a lot from each other, and we can learn how to take care of our patients and how we can study more, how we can are always, how can, it's even a word that, how can they just push us to study more. So, and when you are together, all your actions have a powerful result. So that's why I think that ASPEN and the Brazilian Association of Nutrology, when they just welcomed me in the societies, helped me a lot to be more at easy to work better and to learn more and to be more, how can I say, more trustful in my knowledge, to just go back to the hospital, go back to our fellowships, that we have some fellows there with us, to learn, to help them to improve their knowledge. So I think that's the great passion, is how can we just transform this knowledge for all the patients that we have, not only nutrology, but with all the other specialties that we have in our hospitals, for example.
Yeah, and I think that's great. And I think what you've highlighted in your answer is really that sense of community and that connection with other leaders in nutrition to help foster clinical care. I know, looking at your career, I know you've been involved in nutrition for quite some time and have held yourself some multiple leadership roles, both in your local hospital. How do you find those leadership positions? How did you come about to obtain those positions? And also, how has that helped advance nutrition care in your hospital?
Well, in my hospital, I had the great happiness of helping to create the fellowship. It was the first fellowship in nutrology that was not linked to our Minister of Education in Brazil. And well, till today, we just we formed around 30 physicians in our hospital. So they are spread all over Brazil. So I really feel grateful because I know that thousands of patients are being cared now from with doctors that study with us. So that's really interesting to sometimes think about this impact. So this leadership that I think that all of us could take in our hands is hard work and pursue some kind of excellence to bring to our patients and to our fellows, to all the physicians that take care of our patient.
Yeah, I think that's wonderful and a great feat to your dedication to the field and to education. I think with that note as well, I know you've done some projects in quality improvement as well as data management. Can you touch on some of the quality improvement projects that you've been involved in the past or currently?
Yes, it's something that here in Brazil we have a lot. We have this culture of quality improvement in some hospitals. And the interesting nutrition that while I was working with it, it's that I just realized that how much the nutrition can help patient safety that we say about the patients that are more prone to falls or more prone to pressure ulcers. And when you nourish properly our patient, the number of falls, the number of patients who have pressure ulcers will just fall down. So will reduce. So it's something that I really, really love to do. And it's a very good way to measure what we do and to see if we are improving as a team. So, and that not only the team, but that our care to our patient. So it's a very interesting matter that I really love to work with.
That's wonderful. And I think it really speaks to the field of nutrition being multidisciplinary, but also field
Yes.
of quality improvement. You have different stakeholders, sometimes in hospital administrations and policy writers that can really make a difference. And I think on that note, you know, you've been very well established in your career. Do you have any words of wisdom for early career healthcare professionals in the field of nutrition? Any words of advice or tidbits that you may give to your fellows as well
Yeah.
to take
Well,
forward?
first thing, nutrition is the base for everything, is the foundation for everything. So I remember very well the first time that an orthopedist asked us to evaluate a patient to see if we could liberate this patient to authorize this patient to go through an orthopedic surgery. So it's not such a common thing to happen. And that was for the advice is just always take time to talk to your peers. Always take time to talk to your specialists that are in the hospital, that are taking care of the same patients. Know the case, study the case, and try to show them the very important role that we have to their patients. So that way, I think that they will understand and they will get, well, they will give more importance to our field. So just like that, if the orthopedic surgeon will do surgery in this patient, I will just tell him, if you nourish your patient better, the cicatrization will be better. He'll have less infection. He'll be able to get from the bed sooner. So he will be at his home earlier. So it's something that we all can talk to our peers to say that. And it's a very important thing to say. It's respect your nutritionists, respect your nurses, respect your pharmacists, because truly nutrology, enteral nutrition, and parenteral nutrition is really a teamwork in our hospitals. So that's it.
Yeah, and I think it's so interesting when you talk to surgeons or other clinical outcomes that everyone cares about. really nutrition, I agree, is the foundation of everything.
Yeah.
We may be biased, but I think it's the truth.
Yes.
Yes. Well, thank you so much, Dr. Silvestre, for joining us today. And thank you to ASPEN for their partnership to continue with this program, and our audience for taking the time to listen. I hope you've learned some great little tidbits to take away, and I hope everyone has a great day.